Welcome to IACI TV. My name is Roy Shepherd, and I've been joined by Jurgen Schwarze, who is the Basic and Clinical Immunology Section Chair, but you've been living in Scotland for a number of years as well. Can I just start by asking you, can viral infections influence the primary development of allergic diseases?
Yes, they can. And I think the prime example, and that's the area I'm particularly interested in, is the epidemiological observation that severe respiratory viral infections in early life, in infancy, infections that are called bronchiolitis, convey a much higher risk of development of asthma, and in children this is allergic asthma usually at a later age.
So what's the link then?
Well, there is an epidemiological link initially, and the kind of work I do really focuses on how this might work. But just before I come to that, there are a couple of viruses that are particularly associated with with asthma development. One of them is rhinovirus, which is just our common cold virus, which for most people isn't a problem, but for some children causes a severe infection of the lower airways. They become very ill, and these children or infants then over the preschool years will have recurrent wheeze, and eventually a lot of them will develop asthma at school age. And another virus that plays a big role in that context is the virus I'm particularly focused on in my work. That's called Respiratory Syncytial virus. So you asked how they might do it. We only understand this incompletely, and that's still an area of very active research. But basically, these viruses target the lining of your airways, so your epithelium initially. And when they do that, the epithelium reacts, and it reacts with churning out mediators that we currently call alarmins, which tell cells of the immune system to get ready to fight a virus. But some of these alarmins, particularly prime immune cells, dendritic cells, that in a way that they are set up to initiate what we call type 2 immune responses. So these are immune responses that are associated with allergy.
So the disease activity, is it predictable then? Do they behave in exactly the same way in every situation?
You mean, does the immune system behave in exactly the same way? That's probably strongly influenced by a genetic background.
Okay.
I mean, it does behave in trying to mount a response to control the virus, but there are probably subtle differences between people who have these infections as well and will never develop an allergy, and those in whom these infections are a trigger for immune responses that also then eventually promote the development of allergic sensitization and allergy.
How does the microbiome play a role?
The microbiome is currently obviously of major interest because we know that it shapes immune responses. And what's become apparent over the past 15 years maybe is that our lower airways, so the lung environment, is not sterile as I was taught at medical school, but it's actually full of bacteria, not large amounts, but many, many different bacteria. And we're only just starting to understand how they influence, how different compositions of these bacteria that we all naturally live with, how they influence immune responses. And it seems that there are some bacteria, if they're acquired early in early life, this may be right after birth or in the first couple of weeks.
From where? How do you acquire this sort of bacteria?
You acquire them from your mother's birth canal.
Okay.
You acquire them by breastfeeding, skin contact. That's probably the most important initial route of acquiring your microbiome. This is primarily microbiome of the gut, but also microbiome of your airways. And it seems that if you acquire particular classes of bacteria and compositions of bacteria, that can put you at a higher risk to then develop immune responses, for example, to viruses that eventually will drive you more towards an allergic route and
So
allergy development.
how can precision medicine then help in your field?
So this is something that needs to be developed. If we had tools, if we had biomarkers that tell us after such, or even that tell us which child or which infant, if they have a severe lower respiratory tract infection by viruses, who of them will progress to having long-term problems in asthma, and who will have a short-term problem, which may be severe, but still in the end have no further sequelae, that would be very helpful, because then we might start thinking about who we could target with preventive measures. Now, these preventive measures aren't known. There's many things one could speculate about. It could be a really strong attempt to try and delay the first severe infections, because we know that the risk is highest if these infants are between 2 and, let's say, 4 or 5 months old. And then the risk of long-term problems actually comes down significantly after that. So that could be something. It could be something that after a first severe lower respiratory tract infection, really to come in with medications that suppress inflammation at that time and may then reduce the immune responses that will lead on to allergy development.
What proportion of infants actually suffer from this condition?
The lower respiratory tract infections. So everybody is infected with these viruses. So that's 100% in the first few years. Of those kids, we think that about 30% have lower respiratory tract infection, about 2% severe enough that they end up in hospital, which is huge numbers. 2% of all infants is vast, even if it doesn't sound like a lot. And of these 30% who have these severe lower respiratory tract infection, in the end, again, a third of those will have childhood asthma. So you're still talking about 10% or so of kids who altogether who will have a lower respiratory tract infection with long-term problems.
So a huge part of this is really down the preventative medicine route rather than the remediation.
That would be very much the hope, yes, that you find that you identify those at risk early and that you're able to provide something to them either prior to their lower respiratory tract infection or after, that sort of cuts the whole trajectory of problems short or stops it.
Where is the priority for your research? Or probably multiple
So
priorities.
there's quite a few priorities, but I mean, in my own research, I try to focus on understanding the mechanisms that link these early viral infections to subsequent problems. So how responses of epithelial cells, how immune cell responses are altered by that early viral infection, and how that then translates to long-term problems. And I think if we understand these connections, then we're hopefully in a good position to find what we call biomarkers. So basically changes in immune responses or other biological responses that we can pick up, that we can measure, and that will tell us you're at risk, you should be fine. So I think that is currently where we are, and this is currently the major need.
Okay, Jurgen, thank you very much indeed.
Thank you.
Pleasure to talk to you.
Thanks a lot.
And that's all from IACI TV for now. We'll be back later.